Sorry for the delay. Let's begin our session with Kitab Al-Fatihah. Okay, I think let's proceed.
So today we'll be presenting about picky eater. So before we start, we would like to share a video with you all. Start the video, please.
Is there sound?
There, no sound.
Sometimes when you start share slide, you need to make sure that you tick the optimize for video. Probably stop share and reshare again. But when you share the slide, you share screen and you tick on the bottom. There's an option for optimize for video.
That's just
around the world, specialists are dealing with a deadly new eating disorder very few people know about.
they want to eat the foods that they like, and they only want to eat the foods that they like. You've got your meal and you've got this little bite of disgusting morsel that's just looming, waiting for you to taste, and so now the whole meal is just awful.
Avoidant restrictive food intake disorder, what most parents just call fussy eating, can become extremely serious.
You would think you could reason with her. You cannot reason with her.
I just don't eat that.
So far, the medical profession said, no, it's fine, they'll grow out of it, but they never have.
This is not a fad or a phase, but the child is persistently only able to eat a restricted range of foods. They're avoiding entire food groups. Then it's time to pay attention.
ARFID is not like anorexia or bulimia. It is a new diagnosis, little known and less understood, leaving medical experts struggling to fight an age-old enemy.
I knew it wasn't right, but that's all he would eat.
Jake's case is a very extreme case.
We probably thought he was going to die.
In many ways, Jake Thompson is a typical teenager living in New Zealand, loves his computer games and his dog. Quite likes his parents and his sister, but probably won't tell anyone else that.
Anthony's rocks all right?
Yeah, it's just annoying.
And he's okay with the idea that he could become the poster boy for a catastrophic eating disorder he'd never even heard of.
It all hit me like a ton of bricks. It just crashed on me at once.
He was so grey. He had no energy. His mate would come around and Jake would just have to go to bed. He'd have like shaking fits, like his teeth would actually be chattering. Probably thought he was going to die.
Jake was suffering from an unknown eating disorder, now called ARFID, Avoidant Restrictive Food Intake Disorder. Today, up close, he can only see simple shapes and contrasts, basically because he wouldn't eat his veggies. Jake is now legally blind.
Most of the shooting has to be done from quite far away, and my eyes don't see that far.
ARFID gave him such major health problems, he was like a character running out of credits, caught in a kind of life and death struggle.
Well, it was life and death. I mean, it's not kind of life and death. I mean, we're looking at a kid who obviously has had a pretty extreme case. He went blind from malnutrition, and he lives in New Zealand.
For a long time, Jake didn't look unhealthy. He kept growing, but had a diet some clinicians describe as beige, all soft, white foods. Diane was desperately worried about Jake's eating, but his doctors weren't. He'll grow out of it, they said.
But he's always very happy. He's got a wicked sense of humour. He thinks it's very funny to wind me up, and some of the stuff he says, I say to him, you can't actually say that to your mum. That's actually not appropriate. Since we've been through all the illnesses and stuff with Jake, we've got very close, and I've helped him with stuff that, you know, you probably would never expect to help with.
So in hospital, she would have to hold the bottle while I urinate. It would, yeah, there have been plenty of funny times.
And that is pretty much Jake's diet. It was white bread, potato chips, chicken nuggets and frozen chips. And I knew it wasn't right, but I couldn't get him to eat anything else. Just eat one pea. That's all you had to do, is just eat one pea. And so I got him to stick his tongue out and I put the pea in his mouth. And he just sat there with the pea on the end of his tongue and could not put it back in his mouth. And he had tears streaming down his face.
When she tried feeding me peas and stuff, I thought it was gross. I just wanted to eat potato chips.
We tried the multivitamins, and one time I physically chased him around the kitchen table, trying to grab him to force it into his mouth. And that's when I realised this is actually not working. This is not, you know, if I've got to chase him around and then physically force feed him a vitamin when he's 10 years old and should know better, then there's obviously something not quite right.
Jake has a life-threatening allergy to peanuts, and dairy products make him ill. Allergic reactions, or choking on food, or very strong senses of smell or taste are some triggers of ARFID. Avoidant restrictive food intake disorder didn't exist in medical literature until 2013. But now eating disorder specialists like Roger Mislevich and Kelly Lavender are seeing an increase in ARFID referrals.
And the children that I see, they
So that's the end of the our intro for picky eaters. So with that, we'll be discussing more further on how the children that have picky eater, what is the risk factor, and what is the consequences that will be facing by the children in the next few life, and the differential diagnosis of the picky eater, staging and severity, and also assessment. And lastly would be the management for the picky eaters. So next. So for the introduction, picky eater is a common behavior in early childhood. It is one of the terminologies under the umbrella of eating behavior disorders, where it is defined as children who consume an inadequate variety of food through rejection of a substantial amount of food that are both familiar and unfamiliar. And also being a picky eater, it is also characterized by the rejection of food texture, particular food types, and also the flavor and would be the feel of the food. And this definition has been widely accepted by other in the literature and also research paper, where it is given by Devon Research. And sometimes the picky eater terminologies, the eating behavior disorder also would be related to the elements of neophobia, where the children might have a phobia towards taking new foods or unfamiliar food. So with that, this is the definitions of picky eaters. So next. So before we begin, proceed to the next slide, we need to know what are the risk factors so that we can risk identify early for the early intervention for children who are having this kind of problem. So what are the risk factors that we need to look out for patient who probably might develop being a picky eaters. Firstly would be in early of life. The children might have early feeding difficulties, which also will be proceed with improper weaning practices. And besides that, the patient before this might have improper early feeding practices with history of previous significant illness, where usually for the early feeding difficulties, usually the patient before the few early years of life, the patient might have a frequent colic, frequent vomiting, slow feeding, or sucking difficulties. Is the risk identification for us to diagnose that this patient might develop becoming of being a picky eater. Besides that, for the history of previous significant illness, patient who have a chronic illness in his during his birth might develop being a picky eater. So, delayed introduction to the solids also is one of the cause that might causing the patient to becoming a picky eater. Conflict between caregiver and child at mealtime also would become the barrier for the caregiver to practice the child to eat new food or introducing food that are unfamiliar by the child. And next will be the maternal history of anxiety, eating problems, and body image concern is also one of the risk factors that might causing the child to become a picky eater. And in certain studies have shown that the picky eater might be related to genetic predisposition, where in this genetic predisposition would be the parent would have the sensitivity towards any types of food, such as vegetables, where they have become very sensitive to the taste of bitterness, where they might avoid themselves of consuming that type of food. So with this, the children might inherently get the genetic from their parents with the sensitivity towards the bitter food. So the lastly would be the disturbed sleep patterns in the child, where if patient who have a sleeping difficulties might cause the child to having very low in appetite, and also might cause them lose of focusing in doing something. So this would cause the patient to becoming a picky eater in as the consequences. So next, we move on to the next slide.
Hello, Assalamualaikum. My name is Tafiz. Today, we continuing the presentation as according to Raja. So, I'm going to talk about the types of picky eater. So, just for disclaimer for all you guys, so there is no scientific definition of picky eaters, but it is according to the parents. If the parents say they know when their child develop picky eater, and according to the research, they are likely to be right. So the picky eaters are well accepted by the definitions that Rajas have stated before. Okay, so what actually parents call picky eating is actually a broad spectrum of behaviors. And knowing which category of a child falls into may help the parents develop constructive responses. So I would like to, these types of picky eater that I've listed over there, put in front of the screen, is that it is according to a research conducted in Urbana. So I would like to share about this research and how they how they conduct it, right? So the researchers gathered about 170 children ranging 2 to 4 years old, and about half of them were described by the parents as picky eaters. So for the 2 weeks, the parents fed the family standardized meals and provided by the investigators. So the parents observed and recorded their children responses. So based on the result of this research is that the non-picky eaters kids eat more and did not make a fuss about that thing. So those seen as picky acted differently before and during meals, with behaviors that range from refusing to come to the table and to showing much suspicion of certain foods to clinging or gagging. Right. So the researchers identified 4 possibly overlapping categories of behavior that could cause parents to identify their children as picky eaters. As the first one is sensory dependent eaters, second one is preferential eaters, second one is general perfectionists, and the fourth one is the behavioral responders. So for the sensory dependent eaters, it is actually children that reject a food because of its texture or smell. So they might say like, oh no, the food is yuck, slimy, bitter, hard, something like that. So this is a sensory dependent eaters. So according to this, some of these preferences, such as the sensory dependent also, it is research indicates that some of the children are genetically more sensitive to bitter flavors and some slimy textures of the food. So yeah, this is one of the types of the picky eaters. The second one is preferential eaters. Means that they shun new or mixed foods. When we introduce new food, they try to avoid it, right? So this is preferential eaters. So general perfectionist, it is like OCD types of behavior whereby that. So the child try to avoid that food if the food is not in the same proportion each time, or the food have specific needs, such as the food cannot touch to each other, meaning that if the chicken touch the rice, the child doesn't want to eat anymore. This is general perfectionist. So autism spectrum disorders mainly what we call many in this type of picky eaters lah. So the fourth one, which is the last one, is the behavioral responders. So this kind of picky eaters may cringe or gag when food is not right. Means that the ham and cheese. Let me give you an example. So means that the the ham and cheese in sandwiches, right? The ham and cheese should be on the white bread, not on the brown bread. So if the ham and cheese is in the brown bread, they will not eat lah. And also they may refuse to come to table before they know even what's for dinner lah. Before they know what's even. Right. So I think this is the general types of picky eater that I've found in researchers. All right. So next slide, please. So it is very important for us to actually assess the children based on the history lah. So based on the history, we want to know what is the reason for the children refuse to eat, and also we want to know the general condition of the patients, and also we want to know what are the preferential of the children itself. So among the important questions that we have to ask is that we have to ask the parents, when did the picky eating starts? Second one is, what new foods have been introduced into the diet? Right, this is very important because we might not know that the children might have some allergies or some sensitivity, I would say, to the new foods. Right. So the third one is, what is the child favorite food and what is the least favorite food? So follow-up question from this question is that, is the least favorite food too is just recently disliked it, right? So we have to ask. to know deeper for the picky eaters. So the fourth one is, has the child been sick lately? Right, this is a broad spectrum. Okay, so sick lately means that the child sick in for the GIT systems, meaning that from the mouth, from the oral cavity until the esophagus, until the esophagus, the stomach, intestine, so on lah. Meaning that if the child has tonsillitis, it might be the reason why the child refuses to eat, or the child has fever, or the child has something like abdominal pain, right? So we have to ask. So the fifth one is, we have to ask the family routine, the family's eating routine. So we might not know that the family is a picky eater also, right? So just like let me tell you, like my auntie, no, not auntie, my family also, they refuse to eat in outside outside stalls. So yeah, we don't know. We have to ask about the family eating routine. Right? We don't know that the family just eat once per day. We don't know. We have to ask. Right. So the sixth one is, we have to ask the general condition of the child, whereby the child is active or non-active. This is very important. So the seventh one is, any underlying constipations, just like constipations or in the mouth, psychiatric disorders is very important. Autism and ADHD, just like Rajaf stated. So the eighth one, the next one is, we have to listen more to our children lah. So we have to listen what the child complain about before they refuse to eat. It can be, no mommy, no daddy, I can't eat. Why you? We have to investigate further. So is there are there any complaints of, I don't want to, or I don't like that? So it hurts mommy. This is a red flag also. We have to elevate in the history also. It hurts mommy. Why it hurts? Why it hurts? So there are many follow-up questions after that. And the next one is quite bizarre, but it can be happen. It is that I'm scared, mommy. Meaning that if there is history of abuse before this, abuse in the nursery, abuse by the siblings or the family members, right? So I'm scared. That is very important. So the next one is there any vomiting after meals? So how soon they develop the vomiting, and any the next one is, any major events occurred, just like any what you call death occurred in the family, among the family members, any traumatic experiences experienced by the children. So I think that's all for the history, and next we'll go to the physical examination, whereby we will highlight more about the red flags in the physical examination. So I would like to welcome the next presenters, please.
Yes, Assalamualaikum warahmatullahi wabarakatuh. Good morning. My name is Muhammad Ali, and I'll be continuing the presentation with assessment through physical examination. Right, so from the physical examination, it just goes the like usual, right? So first we starting from the general appearance. Normally patients that kids that are picky eaters would be thin, or in some rare or even extreme cases, they even have wasting. Then we also have to note certain dysmorphic features, for example, Down syndrome and cerebral palsy, as these conditions may have certain risk for a child to get the sensory disorders or even oral motor deficits, which affects the range of motion, the strength, and coordination of oral structures that makes it harder for them to bite down, chew certain food. For example, food that are hard, right, like veggies or meat. So we may misdiagnose them to be a picky eater without actually highlighting the actual problem, which is they are unable to chew. And then We also have to note if the patient has is in any respiratory distress due to infections, and if they are pale or cyanotic from the anemia. And then the next important thing, very important thing, would be the anthropometric measurements. So we have to plot the growth chart, right, from the age to height and also weight to age, right? So if it is normal, the picky eating may be physiological and it's not pathological, and it does not pose any threat. However, if there is lower height or weight for age, the trajectory of the growth, right, it is a cause of concern, cause for concern that we have to pay more attention to. And if we suspect the patient to be wasted, to have wasting, the circumference of the mid upper arm would be helpful in determining the severity. Then next would be the vitals. It may be deranged for certain reasons, maybe from the electrolyte imbalance, or even the complications, consequences from the being a picky eater, which I will touch later. And then the peripherals, the pulses. Then we proceed into the head and neck. We have to check for the oral health, any signs, any angular stomatitis from IDA, right, iron deficient anemia, because maybe they don't eat red meats. And then mouth ulcers that may have that may cause pain, which prevents them from eating normally. So we may see that, okay, this kid is being a picky eater. However, they can't even eat because it's painful, right? Then the jaw range of motion, as I've mentioned before, oral motor deficit. And then if the patient has any swallowing difficulty, and if there is any neck swelling from iodine deficiency, basically goiter lah. Okay, next. Okay, so for example, next would be the cardiovascular system. We should note also if there is murmurs or trills, which are signs of anemia. We also other pathologies, but in this topic, we'll focus a bit on anemia, and later it may progress into being arrhythmia, right? And then the respiratory system, we also have to look for the presence of any adventitious sounds. As picky eaters are immunocompromised, any infections may last longer and may have worse outcomes. Then the abdomen, tenderness again from infection, hepatosplenomegaly, from what you call it, the medullary blood protection. Then if the patient has ascites, and then if they have bloating from let's say lactose intolerance or IBS, which may which is also a risk factor for a kid to not eat, right? Not necessarily being to be a picky eater, but not eat due to abdominal discomfort, right? And lastly, it may be helpful for the patient if we are able to do a digital colorectal examination, especially in cases where the child does not eat any fiber, low fiber intake, veggies or fruits, right? As they are at risk to get fecal infection. And then the red flags for the assessment, not just the physical examination, that we have to pay extra attention if it is present. In picky eaters would be dysphagia, unable to swallow, right? Any history of unable to swallow, odinophagia, any painful swallowing. If the patient has incoordinated swallowing, indicated by cough, choking, recurrent pneumonia, aspiration pneumonia. And if the patient has any interrupted feeding, which is more related to the CVS problem. And And then if the patient has any atopic conditions, for example, eczema, that indicates the patient may have allergies. And if the patient has failure to thrive, any developmental abnormalities. And the last one would be any developmental anomalies. For example, congenital abnormalities and autism, as mentioned before. Next. Okay, so we also have to be aware of certain presentations that is related to micronutrient deficiency. For example, the presence of pitoid spot, right? From the video before, the video, The Truth About the Fussy Eaters, right? We can see that Jake Thompson, the kid in the video, is basically blind. Okay, so this is one of the consequences of being a picky eater, where there is severe deficiency of vitamin A, right? That may cause xerophthalmia or night blindness, that both that will progress into being an actual and blindness lah, right? So, however, it is quite rare to have micronutrient deficiency in picky eaters, as these nutrients are only needed in very little amounts, and most food is has adequate amounts of these nutrients, even if we say that they are not healthy foods, right? So, okay, back to the slide. The first one, pitoid spot, right? The vitamin A deficiency. And then rickets in severe vitamin D deficiency, and scurvy in vitamin C deficiency. So these are the features that we have to pay attention to.
Can I just say something about this slide? I just need to remind you, vitamin D deficiency, rickets, and also scurvy, it's not that uncommon. Rickets, especially we still see, especially in premature babies, we still see it quite frequently. And rickets is a favorite exam question, because we can easily ask in unmanned OSCE. We can just show you a picture of a chest with ricketic rosary, and then bowing of the knees, and so on and so forth. So it's a very easy exam question. It has come up in exam so many times. And scurvy as well. Last year we have one, not last year, I think 2 years ago, we have one patient with, not really 2 years ago, probably around one year plus ago, we have one patient with scurvy. And that child was seen in many hospitals, was seen in Hoshas, was seen in Hospital Jelika, was seen in HTA, finally end up with us, admitted to us for quite a long time, until we make the diagnosis of vitamin C deficiency. So we may think that vitamin C is very common, but well, we still have patients presenting with scurvy. And that's it. Okay.
Thank you, Doctor, for the clarification. Next slide, please. Okay, the consequences of being a picky eater, mainly it's undernutrition, right? So the keyword here is undernutrition, which may stem into different branches, either physical or even the mental development of the baby. So the most obvious one would be stunting, and the patient will be stunted and underweight. And if stunting is present in any children less than 3 years of age, they are at risk to have poorer motor and cognitive development in the future. And then next one would be anemia. The most common one would be iron deficiency anemia, or B12 or folate deficiency, the megaloblastic anemias. And then they will have impaired immune function. I've mentioned before that any infections will be more severe and last longer. Right. And then there will be also loss of cognitive potential, especially in chronic iodine deficiency and iron deficiency. And next one would be mothers, women who used to be picky eaters who end up being undernourished are more likely to have antenatal issues, which is they are at risk to give birth. They are more at risk to give birth to low birth weight babies. So it's like a vicious cycle, right? Undernourished already, give low birth weight babies, which may end up to be also undernourished. Then cycle continues, right? And then if the patient only eats certain food items like snack items and sweets, they may have premature dental problems, right? Especially in kids. And then it goes without saying, if a kid does not eat adequately, they will have decreased attention and energy levels. That is going to limit the interaction with the environment, with their friends. They are unable to play. They are not able to socialize because they are fatigued. That will have a significant impact to their social developments. Okay, and then the last one would be parental stress. So like picky eating can lead to refusal of foods, right? And even negative behaviors from child, for example, screaming or crying when you try to feed them something or even force them to eat something. So these behaviors can all increase parents' stress and frustration when it comes to mealtime, when mealtime comes, right? And it also may lead to negative feelings and attitudes toward the meal times, and even and they have negative feelings to the commonest family routine, which is having dinner or lunch together, right? They are stressed to have dinner. So it may have an impact. It may have an impact to the environment of the family. So I think that's all from me. We will proceed with the staging assessment of the severity of being defeated. Thank you.
Okay, so my name is Nafifa Maris and I will continue the discussion with staging for the severity of the picky eater. So for the severity can be classified into mild, moderate and severe. So the first one is a mild picky eater where the child will have disturbed eating behavior without any clinical evidence of macro or micronutrient deficiency. Secondly is the moderate picky eater where you can see that the child have early growth flattery as the evidence of decreased horizontal growth curve for the weight and height that we already plotted in the growth chart. So the thirdly is the severe one where the child will have disturbed eating behavior with a confirmed growth flattening, which is decrease in the growth curve, as well as there is a clinical and laboratory evidence of micronutrient deficiency, just like already been said by Brother Ali just now, where the common micronutrient deficiency are iron, vitamin A, vitamin D, and vitamin C. So if this child present with the evidence of failure to thrive, as well as a picky eater, it can be classified as a severe one. So next. So next is the differential diagnosis. Okay, next. So before we say that the child is a slowly a picky eater, we must consider other few condition that might appear as picky eating, or there is any condition that leads the child to be a picky eater. So the first one is the food allergy or the lactose intolerance, because child who have a lactose intolerance will have bloating, gastrointestinal disturbance such as abdominal pain, nausea and vomiting that usually occur after they drink a dairy product, making them to avoid certain products such as milk in order to avoid the symptoms from reoccurring. So next is the underlying infection, such as viral infection, like child is common to have tonsillitis or adenitis. So this child who have the viral infection of the tonsil and adenoid usually refuse to eat in view of pain around their mouth. Apart from that, patient who have a child who have gastroesophageal reflux disease may stop eating as to prevent unpleasant experience of food regurgitation or frequent vomiting. That is the emotional distress, where there is a poor family relationship or relationship with the guardian that put the child under stress and most of the time anxious, so causing them to lose appetite and refuse to eat. The next one is the patient who have autism. Autism child usually are fixated on certain food and the presentation of the food. They refuse to eat food that are served in a different texture or way. And when this kind of food is being served to them, usually they refuse to eat and will throw a tantrum, just like the show picture. And the lastly, the psychological disorder also play a role because the studies state that the inattentive symptom of attention deficit hyperactive disorder child usually associated with decreased awareness of internal signal of hunger and satiety, in which in turn causing them refuse to eat and lead to the disorder eating behavior. So lastly, I'll pass to the next presenter for the management of picky eater.
So for the management of picky eater, first we have only two type of management, that is dietary management and also behavioral education and therapy. It will be individualized according to the severity of the picky eater, such as mild, moderate or severe. If the patient comes with mild deficiency, mild nutrition deficiency, we can give dietary and behavioral education as well as counseling, and also to consider supplementation to the kids. If the patient come with moderate deficiency, we will start with immediate mild management and also nutrient supplementation. And if the patient comes with a severe nutrient deficiency, we need to do the emergency moderate management with laboratory testing to test if the patient have any secondary illness that cause the patient to be a picky eater. And next is the dietary management. The first that is done by the clinician or by the dietitian, or the nutritionist. That is the nutritional assessment, and then to do the nutritional intake evaluation, and lastly to do the nutritional counseling plan. For the nutritional assessment, we will do the anthropometric assessment and also to plot the weight and height on the growth chart as mentioned as Brother Ali before. And then we need to do the nutritional intake evaluation, for example by giving the diet food 24-hour diet recall for the parents to fill in, and it will be consisting of a part 1 and also the part 2. That is, in part 1 it consists of the portion of the food and also the size of the portion, and then the type of food such as chicken, beef and fish, and the time for the meals, and also the food source and the ingredient and amount in the food that have been prepared by the mother. This is the right one. The right picture is the example of the food diary, that is the 24-hour diet recall that we give to the patient to be filled. And after that, we will evaluate the patient. If the patient get the total energy requirement fulfill of the day. That is for the 1 to 2 years old. We need the patient, the kids will need 945 kilocalorie per day, and as well as to the, it will be different according to age. So if the children does not get enough nutrient, we will give lastly the nutritional counseling plan, such as to develop meal time routine and plan for 3 main meals with 2 to 3 snacking in between the main meals, and to avoid food fillers, that is eating out of the food meals, and encourage new food that is up to 15 offering, and to lastly to consider nutritional supplement if the behavioral therapy is not enough. And then for the behavioral education and therapy, that is will be done by the child and by the mother at home. The first one is to give the portion for the children according to age. That if you know that the kids doesn't like certain type of food, we will ask the mother to not put so much of that portion in the plate, because the children will when the children notice that there is so much food in their plate, they will less likely to finish all the food. And then to involve the children in menu planning and also the preparation, this will cause the child to feel appreciated and to make feel more important in the family, and to let them use cookie cutter to cut fruits into edible shape, give them tasks such as to tear the vegetable or to wash the vegetable or mixing the food when we are preparing the food, and then to to give healthy food choice to the children, such as vegetables and healthy snack, and don't stop offering healthy food choice to the kid even when they don't like it, because this will only reinforce picky eating more further in the children. And we should not be surprised if the child eat plate full of food one day and the next day the child doesn't want to eat anything, or if the child eat vegetable during this day, but then the next day the child doesn't want to eat vegetable anymore, because the only thing that consistent in the child feeding is the inconsistency itself. And then eat meal with children, and the children should eat what the parents eat. So the children should eat what the other family members eat. So by this, the parent doesn't have to prepare separate meal for the child that is suitable for their liking only. And then we need to expose the children regularly to new type of food. It is recommended that we put 2 safe food. Safe food is the food that was been regularly exposed to the child before, and the child like the food, and then only to add 1 type of new food in the plate at one time. So if the child doesn't like the new food, they still have the safe food to eat, and we should be wise lah about adding a bit of more portion to the safe food, so that if the child doesn't eat the new food, they still can be full even without eating the new food. And to avoid power struggle is, I think it is the same as the child eat what the family eat. Avoid power struggle is that the mother doesn't have to provide a separate meal for the children according to the liking. So the child need to eat what the family eat. And then to change the presentation of the food, if the child doesn't like any vegetable or fruit, we can change the look of vegetable and the fruit itself, such as some mothers might blend the vegetable and mix them in the rice, or to cut the vegetable into interesting shape, or making the vegetable as topping, or and lastly to make the juice out of fruit so that the food looks appealing for the child to eat. Or some might try to play games during eating, asking what is hidden in the plate, and ask the child to guess what is in their plate. And then after the child guess, the child need to eat to confirm the answer of their macam yang dia teka tu. And then give time for the children to get used to the new food, because when we add new food to the child plate, and they see the food, they smell it and they touch it, in which all part of their body are getting used to the new food. So that is why it is recommended that the child should be exposed to the new food with minimum 15 offering to say that they don't like the food. Maksudnya kena bagi, we need to give to try to give 15 times of this 15 times of offering to the child to say that they don't like the food. And then next, don't force, punish or bribe the child to eat, because this will create an anxious environment, as explained by Ali. It will create an anxious environment for the kids to finish the food on their plate. If the child doesn't want to eat the food, let them be, but don't stop putting the food on their plate. Create a stress-free environment for the kids during meals so that they will eventually eat everything on their plate. And then beware of over snacking and choose food with small quantity but high quality. The portion of snacking should never be more than portion of the daily 3 heavy meals. Big portion during snacking make the child feel full and refuse to eat during the heavy meal. And then next, be a role model for the child, or we need to expose the child to role model eaters such as the older sibling, because when the child, the picky eater itself, see the parents finishing the food, they are more likely to be encouraged to finish the food on their plate as well. And other things is group feeding. When the mother set the feeding time the same as the other family member, when the child see that the sibling eats the food well, the child will catch on and set his sibling as example to finish their food also. And then lastly, if the behavioral education and therapy is not adequate, we need to refer to a dietitian. That's all. This is our references.
This is the time when I get to see her again.
Is that all?
These are the immunological investigations that we do for her. So she has hypogammaglobulinemia.
Okay, get back to your last slide.
And then she has infant memory switch.
Before we allow for any other questions, I just want to highlight a few things. The first thing is picky eaters is getting much more common. You know why it's getting much more common? For several reasons. First thing is our average lifespan in Malaysia is increasing. Average lifespan in the whole world is increasing. So previously people die because of infectious diseases, but now people are dying more. There's less infectious diseases except for COVID lah, but people are dying more because of non-infectious diseases before pandemic. So pandemic is a game changer. It's the same as for children as well. Especially for children, especially during pandemic. Before pandemic, children admitted to the hospital because of infectious diseases as compared to adults. Adults, they admitted to the hospital more because of non-infectious diseases. But children, before pandemic, children admitted to the hospital because of infectious diseases. The most common admission cause for children in hospitals are infectious diseases, communicable disease. And very few children are admitted because of non-communicable diseases, diabetes. It's not that many. But with pandemic, with the restriction order, restriction of movement, and so on and so forth, less children are getting infectious diseases. Especially for the first 2 years of pandemic, children do not get. There's not that many children are down with COVID. So you can see our wards, our hospitals, there's not many pediatric admissions before. So more children are admitted because of non-communicable disease, but now things are changing. So what I'm trying to say is the trend of people being admitted is changing. That's one thing. So our lifespan are getting longer. So previously, people who get infectious diseases, they die. if they are picky eater, they don't have enough micronutrient, their body are not that strong, their immune system are not that strong, they'll die easily because of infectious diseases. But because of improvement in our healthcare and so on and so forth, people, because of better antibiotic, better access to healthcare, people can live despite getting serious infectious diseases. So we are getting more. And pregnant mothers can have, even if they get serious infection, they can survive. Their babies can survive. Previously, premature babies, they don't survive, but now we are getting more. So that's why we are seeing more illnesses like this. That's one thing. Secondly, is that we are getting more when we have more when our mortality, neonatal mortality rate are reducing, we are seeing more, and we are getting more premature babies who survives. Among the common illnesses that props up more is actually autistic spectrum, because autistic spectrum is associated with prematurity, for example. So we are seeing more autistic spectrum. And as you know, autistic spectrum is among the cause for picky eating because of how they perceive taste. They have taste aversion. They are averse to certain types of taste, certain types of texture, and so on and so forth. So this is why we are seeing more of these kinds of diseases. And there's more as well, there's more awareness. Previously, when things are difficult, people just, they don't have option. They just eat whatever they have. And because, but now there are more people who are more capable in terms of financial and so on and so forth. So people are more choosy. They can choose what they want and what they don't want. So that's another thing. The other thing is picky eating is not easy. It's not easy to manage. I have 5 kids, and we are still struggling with picky eating. We're still struggling with picky eating. I have 5 kids. I'm a pediatrician. I'm a neonatologist. I still struggle with picky eating. The thing is, few things you need to remember. Children, in terms of their development, they start to gain independence by the age of 2. So before the age of 2, they follow whatever you ask them to do. You ask them to do this, they do. They sometimes you can, it's easy to psycho them to do things. But the moment they reach 2 years old, they learn to say no, and they really meant no. If they say no, it's going to be very difficult to get them to agree to you. So the idea is you need to introduce them to different types of food before 2 years old, before they actually know how to say no. So you need to introduce them to those different kinds of tastes. And introducing them to those tastes is something, but to continue with that type of taste and texture is very important. So it's not worth it to just introduce before 2 years old, and then you don't give for many months, and then you expect them to retry with that taste again after 2 years old. It doesn't make sense. So introduce early, before 2 years old, and continue to give those kinds of tastes. The other problem I foresee is that, you know, our children, one problem that I have in my family, for example, so different children, they have different types of preference. So especially the boys and girls, and yeah, so it's going to be very difficult. The other problem I foresee, I experience is that you know, you see the item number, which one? Change presentation of the food. And change presentation of the food. Okay, if you talk about Western types of cuisine, it's very easy to make whatever your meal to be presentable, very interesting, colorful, and so on and so forth. But Asian type of meal, it's a bit difficult to make it interesting. Because we in Asia, we focus on taste rather than presentation. The best food that we have is not presentable at all. Doesn't look interesting, but it's very tasty. Western food, they may look very nice, but the taste is crap. So that's one thing. So to get them to be interested in something, I think it's a bit trickier in our culture, because we don't. It's very difficult to make to improve the presentation of, well, nasi and tom yum, for example. How to make it interesting? How to make the presentation better?
Maybe we can decorate the tomato.
And you expect the child to eat that tomato. I don't know lah. I don't see how it can be done lah. I've seen some people, they like the egg can, they make it more interesting shapes and so on and so forth. Okay, like egg, we can garnish the egg and make it looks more interesting. Or if you do like nasi goreng apa yang wrap with egg tu, nasi goreng apa?
Pattaya.
Nasi goreng Pattaya kan, you can make it more interesting. But then I don't know, sometimes it works, sometimes it doesn't. But if you look at, if you go through, I presume you've seen in your preparation kan, you've seen how Western cultures, how they design, how they present, how they change the presentation of the food. They make it look very interesting, how they shape the carrots and so on and so forth. It looks very interesting, it looks very appealing. So I think that's something that we need to explore lah. I still have no idea how to do it, but I think well, I've met several dietitians as well, and I think it is still a struggle. It is still a struggle. One solution so far I've seen kan, sending children to hostels sometimes can be a good idea. I don't know lah. Sometimes you feel hungry, more hungrier in hostels. I don't know. And sometimes you don't have that much option. If you don't eat, then you'll starve. Probably. I don't know. But I think that's one thing that can happen. But yeah, picky eater is something that we are seeing more and more common. And another important aspect of treating picky or fussy eating is actually to look at the, well, macronutrient deficiency is very easy to see, very easy to assess. The difficult component is actually to assess the micronutrient deficiency, because macronutrient deficiency you can see from far. If you cannot diagnose macronutrient deficiency, you are in trouble. You should not become a doctor. So macronutrient deficiency is very easy. It's very easy to assess. It's very easy to investigate. It's very easy. It's easier to actually manage. The more the more trickier part is actually to diagnose, to investigate, and to manage micronutrient deficiency. So those are the problems, and we still see lots of micronutrient deficiencies: zinc deficiency, copper deficiency. And even other types of even things like vitamin D deficiency is very common. Iodine deficiency as well. So yeah, it's going to get more challenging, especially when you all become doctors later. Okay, all right. Any question from the group?
Doctor, I have one question. Is there any specific duration for us to allow home management before we refer them to dietitian?
Okay, presenter. Siapa present? Management. We should allow presenter to answer first.
I'm not sure, Doctor.
Presenter not sure pula. Aduh. No, there's no actually cut-off point in terms of time. The importance is to look at the severity. If the child comes in severe condition, like severe zinc deficiency causing what zinc deficiency can cause: immunosuppression, skin disorders, So sometimes you need to even admit before even allowing home management. So, well, it depends on the severity. Depends on the severity and depends on the clinical condition at presentation. So, but majority I would say majority can be treated at home first. The reason being is that the reason being is that especially in sorry, dietary problems like this, it's not easy to treat in hospital because people don't eat normal things in hospital. Hospital food are crap. No one likes hospital food. So if you want to even improve meal, if you want to improve dietary intake, it's gonna be very difficult to start in hospital because no one eats normally in hospital. No one, nobody eats normally in hospital. So if you need to admit, then you want to change the diet in the hospital, it's going to be very difficult. It's going to be very difficult unless if you can make sure that the mom still cook still and everything. So I think so that's the idea. So you only admit if it's severe condition where you need probably, well, we have before one patient we need to admit because we need to give total parenteral nutrition, where you need to give IV medication and so on and so forth. So those are the kinds of patients that you need to admit. You need to start antibiotic, you need to do things, you need to give IV supplementation, you need to give chelation and so on and so forth. So those are the kind of patient that you need to admit. But otherwise, if you want to improve diet, then the idea should be at home. Okay.
Okay, thank you, Doctor.
Okay lah, alright. Any other questions?
Doctor.
Yes.
Okay. Let's usually picky eaters, children who are picky eaters, a lot of them avoid vegetables, right? However, from my reading masa buat preparing the slides, I've came across some cases where the picky eaters actually prefer vegetarian punya diet. So regarding that fact kan, is it actually safe or preferable for them to be on the vegetarian diet? In how severe it can be compared to
the thing is because you need to remember you need some essential proteins, essential amino acids, which you can only get from meat. That's why vegetarian diet is not healthy. Vegetarian diet is not healthy. We in Malaysia, we assume the commonest picky eating is actually a version of vegetable. That's not true. That's not true. I've seen picky eater who the child actually prefers carbohydrates and also vegetables. The thing is that's not enough. Vegetables are high in some micronutrients, vitamins, iron, copper, zinc, but they don't have enough protein. They don't have any protein, for example. So you need more. You need all the micronutrients and macronutrients as well. So, and there's a lot of type of, so there's vegetarian, there's vegan. Vegan and vegetarian is not the same thing. And you have the pescatarian, where the child only eats fish, for example. So there's a lot of types, and vegetarian is not picky eating. Vegan is not picky eating. Pescatarian is not picky eating. So picky eating is totally different. Picky eating is just they are averse to certain types of groups of food lah. So that's the thing. Whether which type of picky eating is better? No, there's no type of picky eating that's better. All types of picky eating is not good. All types of picky eating is not good. Okay. Okay lah, alright. I think that's it lah. That's my threshold already. Okay. Let's end our session here. Let's end with tasbih kafarah in Surah Al-Asr. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum. Thank you very much.
Okay.